Hi everyone, I'm Dr. Kim Shepard with Aligned Family Wellness. Today we're going to be talking about constipation and your kiddos. So we're going to talk about what is constipation and what we can do chiropractically to help your kiddo with their constipation issues. So first of all, we want to define what truly constipation is. So constipation is if you, your child, or your teen has less than 3 bowel movements a week. That's considered constipation. People can have chronic constipation, kiddos especially. So chronic constipation is infrequent bowel movements or difficulty passing your stool. It can persist for several weeks or longer. Some kiddos can actually suffer for years with chronic constipation, and it can be pretty miserable. If you've ever had it yourself, or if your kiddos ever had it, you know how uncomfortable they are. And so we're mostly going to be talking about like little babies and kiddos today, but also know that this can happen in teens and adults. Same concepts pretty much apply. So we're going to talk about some signs and symptoms of constipation. If you're not sure if you've got a little one that can't communicate, let's talk about constipation and what are some signs and symptoms. So once again, it would be passing fewer than 3 stools a week. They're also hard and they're lumpy and they're difficult to pass. So there's lots of discomfort when they're trying to pass those stools. Straining or feeling pain during the bowel movement is actually a sign and symptom of constipation. You should not be uncomfortable having those bowel movements. A lot of times some people more in adults and teens can feel like they've got a blockage or restriction where they're really having trouble going to the bathroom, but they can actually feel some of that restriction in their stomach. And it also, some kids and parents of littles, you understand this, chronic constipation, some kiddos actually need help getting that feces out. So they need help emptying their rectum to get that bowel movement out. And so that's an unpleasant experience for the kiddo and for the parent. So those of you who've been there and you understand this, stay tuned. We're going to unpack this for you. So the traditional medical treatment for constipation is actually Miralax. So that's just a laxative. There's all forms of laxatives, but for kiddos, usually it's Miralax. Miralax has a host of side effects that can even relate to behavioral changes and mood swings commonly being reported with use of Miralax. So really, Miralax hasn't been approved for kids. Its FDA label is for children or for people 17 years and older. So it is not approved. Its off-label usage is when they're giving it to these kiddos. So it is not approved for little kids. It's just basically they have no other way to treat and they don't know what to do. So they just have you use Miralax as an off-label. But the side effects are worse than actually using the product itself. You know, some people have had to use enemas and things like that. And we don't want that for your kiddo. We want them to be able to have nice frequent bowel movements that don't hurt and are not uncomfortable. So we're going to look at some of the causes of constipation. There's a lot of different things that could be a cause. So first, I know as a parent, you're going to look at their diet. So we're going to look at nutrition issues, or we're going to look at food allergies. That's always kind of the first go-to is like, maybe you've got a gluten or dairy sensitivity in your kiddo, and it's just really aggravating their gut and they're not able to have good bowel movements because there's a lot of inflammation. Not enough fiber, that's a big one. Everybody kind of knows that. So, you know, that's kind of a simple one to work on, getting enough good fiber in their diets, and not fiber supplements. We're talking good, healthy foods, leafy greens, oatmeal, you know, apples, fruits with skin on them that have good fiber. Magnesium, deficiency in magnesium also can cause constipation. So there's a lot of great, you know, magnesium supplements out there that can help, but we need to make sure we're doing the right magnesium for your child. And we work with that in our office, making sure you get the right thing. I'm sure you guys have heard of pre and probiotics. Those are the things that our good gut bacteria feed on. So we need a good balance of prebiotics and we need a balance of probiotics. And there's a lot of good products out there that help with that. You know, kombucha and kefir and probiotics and fermented foods. And so that is something that we want to look at and make sure we're getting enough of in your kiddo's diet. Hydration is a big one. Water. Not juice, not milk, not anything but water. Your kids need water, and they need a lot of water because the water will help push the stool along through their digestive tract. So we want to make sure your kid is hydrated and getting enough just good quality water. So if those are some things you can start with, but most of the time when parents get to us, they've tried all of that and they're still frustrated and they still don't know what to do and their kid is still miserable. So let's look at some deeper causes. So a deeper cause could be a neurological problem. So one of the most important elements in our digestive health is our digestive motility, the movement of our digestive system. So the digestive system is made up of muscles and nerves, and they work in coordination to move things along down the digestive tract. And those are some of the primary functions. Kind of eat, sleep, poop is what we say when our infants come in. Are you doing those three things? Those are the primary functions that we worry about with chiropractic. So the final step in your digestion is the elimination part. And so our digestive health and well-being can't happen if our nerves and muscles aren't moving well, and that smooth muscle of the digestive tract is being interfered with, and then the motility slows down or it stops altogether. And then we get issues. And that is more of a neurological problem with the nerves and the muscles. So the number one most common finding we see as the primary cause of constipation in our kiddos and patients with motility issues, or the peristalsis of the digestive tract, that is being interfered with and malfunctioning. So in chiropractic, the term for interference and dysfunction is known as subluxation. So basically, subluxation is stress stuck in your spine. So as pediatric chiropractors, Aligned Family Wellness, we focus on finding what that root cause of the chronic constipation is so that we can fix it if we can remove that stress stuck in the spine, that subluxation, and that is preventing the nervous system to work properly in the digestive tract. We will get some pretty good motility in that digestive tract right away. I tell a lot of my mamas who bring their infants in after their adjustment today, they're going to poop a lot and they're going to sleep a lot. So be ready for that when we remove that interference in the nervous system. But our insight scans that we do in our office are all the neurological based scans that show us the stuck stress in their spine. So a lot of times we can feel it, but we also want to double check with technology and make sure those are the exact spots we need to be treating. And so we always check the lower spine, pelvis, and sacrum for these areas of stuck stress. So sometimes it's not just stuck stress. You know, the kiddo's not just stressed. Maybe they had a big fall. Maybe they fell off the bed. Maybe they had a sports accident. Maybe they had a birth trauma where they were just, stuck up in mama in a bad position. And so things got a little twisted in there, and there's some stuck stress from birth trauma. So when we figure out where we need to work on, what areas are stuck, what areas have that stress stuck, we can coordinate that back to levels of the spine that work with the digestive tract. And we show you that on our insight scans. But we look at it, we find the spots, we adjust it, and we set up a specific care plan for your little one, or your even not so little one if they tend to be a little bit older, because we do tend to see constipation in, your 8, 9, 10, 11-year-olds. But if your child is struggling, if you're struggling, if you don't have answers, give us a call. We will be happy to answer any questions that you have. We will be happy to get your kiddos scanned, get them looked at, just talk, and then talk about a treatment plan, talk about chiropractic and how we can help. But as always, one of the number one things we find with our kiddos with constipation is that adjustment makes a world of a difference. And then we can do all the other things in addition to it. But sometimes that's the missing piece, and that's what your kiddo needs. So make sure they're not suffering. We would love to help you. You can find us on, Facebook here. You can message us, Instagram, our Aligned Family Wellness Chiropractic website. Reach out to us, let us know, give us a call. Our number's listed up here. So thanks for listening again today, and we'll be back next week.